Inner eyelid a little shown and eyelashes unbalanced after Asian blepharoplasty, 10 days post-op. Hi, can somebody help me with this? My left eyelid is a little shown and eyelashes are pointed more upwards compared to my right eye. Looks like I've big and small eyes when I'm taking a picture. Help! I know it's day 10 after surgery, but just want to know if this is permanent. Will it be balanced after my eyelid deswells? Anything I can do to resolve this? Thank you.
Thank you for your question. You submitted a photo showing your eyes 10 days after undergoing Asian eyelid surgery. And you've expressed a concern about the inner aspect of the left upper eyelid showing more eyelid, as well as the eyelashes turning upward more when compared to the right. And you're asking if this is normal and what to anticipate. Well, I can certainly give you some understanding of how I discuss this kind of concern with my patients. A little bit of background: I'm a board-certified cosmetic surgeon and I'm fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and I do specialize in Asian eyelid surgery. So certainly these types of questions come up when we discuss the procedure before surgery. So understanding that 10 days after Asian eyelid surgery is really early in the process of healing. What I always try to differentiate is that when you talk about non-Asian eyelid surgery, where swelling can have different impact on the appearance of the eyelid crease, with Asian eyelid surgery, the crease is front and center of the goal of a desired outcome. Essentially, when we do Asian eyelid surgery, whether it's with the non-incisional or the incisional method, the goal is to fixate the skin in a way that creates a fold in a way that you want. And so preoperatively, what I routinely do is I'll actually position a instrument, something simple like a Q-tip, push up the eyelid skin and show what I can most likely achieve within reason after surgery. And once we have settled upon that, we decide, is this a situation for an incisional procedure or a non-incisional procedure? The decision to do an incisional procedure usually means that there is some skin to be removed as well as some fat, even though there are some blended procedures such as a limited non-incisional procedure with fat reduction. But that's a technical topic. That being said, it is very common after 10 days to have swelling, particularly also to have asymmetric swelling. This is not specific to Asian eyelid surgery. Pretty much it is common for all eyelid surgery. And as far as the orientation or direction of the eyelashes, it is not unusual that swelling can impact the shape and the appearance of the eyelashes. Understanding that Asian eyelid surgery is often a very significant progression from the point of surgery all the way to about 6 months, where swelling can shift and diminish and have a continual evolution until the final outcome is achieved. Technically, surgical healing can take up to a year. And factors and variables such as sinus and allergies can also play a role in how the swelling changes. So I think it's very important that you discuss this concern with your doctor. No one knows your surgery better than the surgeon. And the surgeon who performed it will recall details about your surgery and certainly give you some perspective as to what you can anticipate. What I do in my practice is I will, on the day of the procedure, do my drawing and planning and show the patient what I'm doing. This is done in the exam room before we're brought into the operating room. And we'll even have the photos of the drawing printed out for the patient to see so that they can actually know what I'm doing and understand conceptually what I'm doing. So this type of communication I always feel is so critical, so that during this process of healing after this treatment or after this surgery will be predictable. Now, of course, it is one thing to understand it and it's one thing to go through it, which is why it is important to have regular follow-ups with your doctor. In our practice, we see people at 1 week, 1 month, 3 months, 6 months. But I always tell patients the door is always open. Come in whenever you have any questions or concerns. As a surgeon, as someone who wants to examine them, so that I prefer them coming in and as often as they need to, so that they feel that that I'm answering the questions that they have, and that really helps expedite the healing process. So meet with your doctor again, discuss these concerns, but I think at 10 days it's not unusual to have these types of this type of asymmetry. So I hope that was helpful. I wish you the best of luck, and thank you for your question.